Hi, I'm Ed McGeechee, President and CEO of Southern Maine Healthcare. After vigorous efforts to ensure the continuation of healthcare in Sanford, the Goodall Hospital Board of Trustees and Administration recognized that the organization was on an unsustainable course. They turned to Maine Health in 2012. As a result, Southern Maine Healthcare was formed in January of 2014 in order to bring more resources to bear on the daunting challenge of maintaining vital health care in the Sanford region. The Board of Trustees and Administration of Southern Maine Healthcare has spent countless hours and engaged expert resources to plan for the future of healthcare in the Sanford region. The first step was to stabilize the Southern Maine Healthcare Sanford operations. Southern Maine Healthcare invested more than $5 million to restore competitive wages and benefits to our Sanford colleagues, replaced outdated technology and equipment, and completed needed facilities repairs. We then undertook a thorough study of facilities across the entire Southern Maine healthcare system. That process concluded that the original Goodall Hospital building is old and failing. We considered the feasibility of replacing the building with an entirely new healthcare facility. However, Goodall Hospital had invested in relatively new additions to the medical center and a medical office building, which still carry an $8 million mortgage. This has led us to consider the feasibility of renovating and adding to the current Sanford campus facilities. This complex planning effort is not yet complete. However, our review of services is complete, and I am pleased to share positive news with you today about the depth and breadth of services we will be providing to the people of the Sanford region now and in the future. The service delivery planning process involved many departments and individuals, all with a single goal: to determine the best way to ensure outstanding health care for the people of the Sanford region. I am pleased to report that based upon the results of that study, Southern Maine Healthcare will be investing in the future of health care in the Sanford region by recommitting to full-time emergency care provided 24 hours a day, 7 days a week, year-round at the Sanford Medical Center. The opening of a walk-in care clinic in Sanford for convenient, non-emergent care, similar to the SMHC clinics in Kennebunk, Saco, and Waterboro. The continued availability of elder care services in Sanford, including upgraded facilities with private rooms and modern amenities. The recruitment of up to 10 primary care providers to enhance access to care. Convenient access to more specialists in Sanford, such as cardiologists, neurologists, and pulmonologists, making it easier to get advanced care without having to travel. Opening a new cancer care practice to ensure that oncology services will once again be available in Sanford. Ensure that day surgery facilities and the latest in diagnostics and therapy programs are available in Sanford. In other words, for those tests and day surgery procedures that do not require an overnight stay, you can still come to the Sanford campus. This is exciting news that demonstrates the depth of SMHC's commitment to quality care in the Sanford region, now and in the future. The service delivery planning process also concluded that inpatient care, care that requires an overnight stay in the hospital, is best delivered at the Biddeford Medical Center. This change is being made for one reason only: the small number of inpatients cared for in Sanford. Residents of the Sanford region who are acutely ill will benefit from the depth of complex clinical support available at the larger Biddeford Medical Center. This follows a national trend in health care. Fewer people require inpatient care, while more people are being treated successfully as outpatients. Locally, SMHC is treating an increasing number of patients in our emergency departments and in our walk-in care centers, and seeing fewer hospital admissions, especially in Sanford. Caring for all of our inpatients at one location, where a greater number of specialists and technologies are based, makes sense. This will ensure that all of our acutely ill patients receive the same level of clinical and technical support. Our goal is to make it easier than ever to access Southern Maine Healthcare's great care. Expect more enhancements in the future. I look forward to sharing even more positive news as we continue to grow our partnership with you, as together we shape the future of healthcare in the Sanford region.